Hi, and welcome back. In this short video, we're going to quickly cover other effective evidence-based therapies that can help your child with autism or your child who may be at risk for autism. Remember, the most important and effective therapy for autism is behavioral therapy based on the science of applied behavior analysis, or ABA. For ABA, or behavioral therapy, to be as helpful as possible, there are some other therapies that can complement. The most significant complementary evidence-based therapy to ABA is speech therapy. Physical therapy and occupational therapy can also be helpful. We'll talk about those in just a minute. But let's talk about speech and language therapy first, because it is the most common and effective evidence-based treatment to complement behavioral intervention, or ABA. Please remember, the information in this program is not meant to diagnose or treat, and it should not take the place of consultation with a qualified healthcare professional. So, what is speech therapy? Speech and language therapy addresses challenges with language and communication. It can help people with autism improve their verbal, nonverbal, and social communication. The overall goal is to help the person communicate in more useful and functional ways. Communication and speech-related challenges vary from person to person. Some individuals on the autism spectrum are not able to speak at all. Others love to talk, but have difficulty holding a conversation or understanding body language and facial expressions when talking to others. A speech therapy program begins with an evaluation by a speech-language pathologist, or an SLP, to assess the person's communication strengths and challenges. This evaluation with the SLP creates individual goals for therapy. Common goals that an SLP may set could include improving spoken language, learning nonverbal skills such as signs and gestures, or learning to communicate using an alternative method, such as pictures or technology. Examples of the skills that speech therapists may work on include strengthening the muscles in the mouth, jaw, and neck, making clearer speech sounds, matching emotions with the correct facial expression, understanding body language, responding to questions, matching a picture with its meaning, using a speech app on an iPad to produce the correct word, modulating tone of voice. If you think speech therapy may be helpful for your child, you can find a qualified speech therapist through speaking with your regular nurse or doctor. You can also visit the American Speech Language Hearing Association's AAC webpage for more information. Some people with autism find that using pictures or technology to communicate is more effective than speaking. Speech therapists, or SLPs, are knowledgeable about this and can help. This is known as alternative augmentative communication, or AAC. Examples of AAC methods include sign language, picture exchange communication systems, also known as PECs, iPads, and speech output devices, such as a Dynavox. The speech-language pathologist can help to identify which AAC method, if any, is right for someone with autism and teach him or her how to communicate. Again, speak with your nurse or doctor, and you can also visit the American Speech Language Hearing Association's AAC webpage for more information. Children on the autism spectrum may have delays, differences, or disorders in many areas. In addition to developmental delays, most have low muscle tone and experience difficulty with gross motor coordination, such as running, kicking, and throwing, and fine motor skills like drawing and writing. These issues can interfere with basic day-to-day functioning, and they're almost certain to interfere with social and physical development. In fact, noticing some of these sorts of physical delays may be a clue that your child is at risk for autism. Physical therapists and occupational therapists are trained to help with these issues. Not only can they help your child to build muscle strength and coordination, but they can also do so in the context of daily activity and play, making it more enjoyable. As a result, physical functioning and social skills can improve at the same time. If you think physical or occupational therapy may be helpful for your child, you can find a qualified therapist by speaking with your regular nurse or doctor.